Okay, hello everybody and good morning. I'm happy to be here. So my name is Samir and my tutor was Dr. Christian Gaspar, and our research was on chronic inflammatory intestinal disorders in hidradenitis suppurativa. First, I would tell you this will be the layout of my presentation, the research background and my motivation behind it, the hypothesis of our research, the methodology we used, then we will discuss the results, and finally the conclusion of our research. So first and foremost, what is hidradenitis suppurativa? That is a chronic inflammatory skin condition characterized by deep-seated nodules, abscess, fistula, sinus tract formation, and scars, mainly found in the axilla, inguinal area, submammary, and perianal regions. Those are also called intertriginous regions. It has a young adult onset, mostly around puberty. It is a painful condition and it impacts the quality of life. Many ways can be used to measure the severity of hidradenitis. However, for the sake of our research and the system we use in our clinic, that's the Hurley clinical staging system. And many comorbidities occur with hidradenitis suppurativa. What we are concerned with in our research was CIID. What is CIID? Now, that is chronic inflammatory intestinal disorders. It includes many inflammatory intestinal disorders. For the sake of simplicity, I included the ones that our patients have shown. First, we start with IBD, that is the umbrella term for Crohn's and ulcerative colitis. Microscopic colitis, both forms lymphocytic and collagenous. Segmental colitis with diverticulosis. And those disorders are diagnosed using colonoscopy and biopsy, and that is the gold standard till now. For the research background, this stems from the fact that in the recent years there had been an association between hidradenitis and CIID due to sharing similar pathological features as well as some similar genetic susceptibilities and many similar inflammatory markers. The prevalence of HS is around 1%, IBD is around 0.5%, the CIID as a whole, we don't have data on, and the prevalence of IBD in HS, that is 3.3%. And the opposite way around, prevalence of HS and IBD is even much, much higher, but that is out of the scope of our research. The motivation behind our research is the IBD community. I myself am a Crohn's patient, and of course the love for medicine and patient care. What is the hypothesis of our research? Can non-invasive methods indicate the need or evasion of colonoscopy in HS patients? If that is true, that could mean less cost on the healthcare system, less workload, and even better patient satisfaction. Of course, all those need to be researched and proven by statistics and surveys. However, this is the motive behind our research. The methodology we used, that of course happened at the Department of Dermatology at Debrecen University, we collected 76 HS patients with previous colonoscopy results, and 11 of those have shown positive for CIID based on colonoscopy. The duration of the research was from December 2020 to December 2022. And the method we used, me and Dr. Gaspar, have taken the history of those patients, focusing on HS and possible GI distress signs, because this is what we are interested in. And we took note of the habits of the patients. We also physically examined the patients, again focusing on HS. We also calculated the BMI. And finally, blood sample analysis, which was done at the laboratory department here in Debrecen, focused on WBC, CRP, ASCA-IgA, IgG, and NOD2 polymorphism. A brief word about ASCA, that stands for anti-Saccharomyces cerevisiae antibody. That antibody is against antigens found on the cell wall of yeast. And the NOD2 polymorphism we're interested in because the NOD2 gene produces the NOD2 protein, which plays an important role in immune response. For the statistics, that was done by statistician Dr. Janka Esther. She used Shapiro-Wilk, Mann-Whitney, Kaitas, and Fisher-Exact test. Now coming to the results, before I talk about the results, we need to know that based on the result, we divided the patients into two groups, HS only group and the HS plus CIID group. For the clinical result, the HS onset, family history, and gender as a male, those three did not show any significant difference between the two groups. For smoking, that is a strong risk factor for both HS and CIID, so therefore, naturally enough, we will see almost similar results. The mean average of BMI, however, was much higher in HS only group. Moreover, the overweight and obesity group in HS only was also higher compared to the HS plus CIID. And finally, the clinical picture in HS plus CIID was more severe. More early stage 3 were diagnosed in this category. And those are the p-values. What about the laboratory results? Out of all the parameters, the ASCA IgG was the most interesting. And we found that the blood concentration of ASCA IgG in HS plus CIID is much higher compared to the HS only group. And this is the ROC curve distribution of ASCA IgG and the area under the curve of 0.77. The values of ASCA IgG, the sensitivity is around 72%, specificity of around 70%, positive predictive value 30%, and the negative predictive value of 93.88%. What are the conclusions? We conclude that HS patients with CIID were defined as patients with lower BMI compared to the HS only group. Those with concomitant CIID had a more severe HS clinical picture. And finally, the ASCA IgG results with relatively high specificity and sensitivity helped stratify the HS patient from those who needed colonoscopy to those who did not need it. And therefore, ASCA IgG deserves the attention, and its clinical implementation could be of beneficial use. Those are my references. And I would like to especially thank Professor Dr. Andrea Segedi for this opportunity, Dr. Christian Gaspar as being my tutor, Dr. Janka Ester for the statistical part, and Dr. Palat Kakaroy, and the Department of Dermatology as a whole. I would like to end this talk by saying that research is to see what everybody else has seen and to think what nobody else has thought. Albert Saint-George. And those are my contributions. Thank you very much.
It was a very nice presentation, so open for questions.